Hello, my name is Dr. Dewan S. Raja. Today I will discuss about von Willebrand disease. Von Willebrand disease is the most common inherited bleeding disorder of humans, affecting about 1% of adults in the United States. This is an autosomal dominant disorder caused by a deficiency or dysfunction of von Willebrand factor, a clotting protein in the blood. So it is mostly autosomal dominant, but rarely it may be autosomal recessive, and also very rarely may be autoimmune type of von Willebrand disease. This condition is named after Erik Adolf von Willebrand, a Finnish physician who first described it in the early 20th century. Von Willebrand factor plays a crucial role in blood clotting by assisting platelets in forming clots at the site of blood vessel injuries. There are three main types of von Willebrand diseases. We'll go to them gradually. So what is the pathogenesis of von Willebrand disease? Von Willebrand factor is synthesized in the endothelial cells and megakaryocyte, the precursor for the platelets. In primary hemostasis, von Willebrand factor binds to platelet receptor GP1B9 and subendothelial collagen, thereby promoting platelet adhesion to collagen. People with von Willebrand disease have compound defects in platelet function and coagulation, but in most cases only the platelet defect produces clinical finding. The exceptions are in rare patients with homozygous von Willebrand disease in whom there is a concomitant deficiency of factor VIII, severe enough to produce features resembling those of hemophilia. Okay, if we look at the function of von Willebrand factor, then we can learn the pathology better. So let's get structure and function of factor. Factor VIII is one of the blood clotting factor, von Willebrand factor complex. This is factor VIII and von Willebrand factor complex. This is the blood vessels lined by the endothelial cell luminally, and we have some endothelial receptor for the von Willebrand factor to the subendothelial tissue. Okay, and this factor and von Willebrand factor are together. They are present in the blood. So factor VIII and V, that is von Willebrand factor, circulate as a complex like this. Von Willebrand factor is also present in the subendothelial matrix of normal blood vessel like this. This is the subendothelial matrix of normal blood vessel. Following its activation by thrombin, factor VIII dissociates from von Willebrand factor and takes part in coagulation cascade by forming complex with activated factor IX that activates factor X. So this separate out, and it helps in cascade of coagulation. Okay, coagulation cascade by forming complex with activated factor IX that activates factor X. Von Willebrand factor causes adhesion of platelets to subendothelial collagen like this, platelet subendothelial collagen. Okay, primarily through glycoprotein 1b. This is the GP1V. Okay, 1b, GP1b. Okay, we got that. platelet receptor aggregation of platelet occur through bridging interaction involving the platelet glycoprotein 1b3a. This is 1b3a. This is the platelet. Okay. And this is the fibrinogen activated aggregated platelets here. So, von Willebrand factor very essential for the function of factor 8 plus 9 and 10. So if this is absent, then platelet cannot adhere to the subendothelial matrix. If there is a gap in the endothelial cell, then it should be sealed very quickly by platelets by this. Okay. So if there is no von Willebrand factor, then platelet adhesion is disturbed. Okay, it cannot adhere to the subendothelial matrix. Types of von Willebrand disease. Type 1, this is the mildest form, characterized by partial deficiency of von Willebrand factor. People with type 1 von Willebrand disease may experience mild bleeding symptom, often in response to surgery or injury. Type 2, this type is characterized by qualitative defect in the von Willebrand factor. There are 4 subtypes, 2A, 2B, 2M, 2N, each with specific abnormalities affecting the function of von Willebrand factor. Type 2 can range from mild to moderate severity. Type 3 is the most severe form, involving near total absence of von Willebrand factor. Individuals with type 3 von Willebrand disease may experience spontaneous bleeding, including joint and muscle bleeding, and are at risk of severe bleeding after injury or surgery. Symptoms, diagnosis, and treatment. Symptoms, it may be asymptomatic. Von Willebrand disease may include easy bruising, prolonged nosebleed, there is epistaxis, heavy prolonged menstrual period, there is menorrhagia, or in some cases it may be so mild people cannot realize it. Okay, in severe cases, joint muscle bleeding. Severity of symptom can vary widely among individuals. So not necessarily everyone will have severe problem. It may be, for many person, may be asymptomatic also. It may be very mild, may be severe, rarely. Diagnosis involves combination of clinical evaluation, family history assessment, and laboratory tests to measure levels and functions of von Willebrand factor and other clotting factor like 8, 9, 10. Treatment depends on the severity of the condition. Mild cases may not require treatment, while more severe cases may involve medication such as desmopressin, DDAVP, or replacement therapy with von Willebrand factor concentrate. People with von Willebrand disease should work closely with the healthcare team to manage their condition and prevent complications. Okay, and that's all about the von Willebrand disease. If you have any question, please feel free to ask me. Please support my channel. Please subscribe me. And have a nice, wonderful, and blessed day. Bye now.